Welcome to another outreach section. This is where I can counseling outreach. I still remain your online counselor. My name is Rachel. So today we are going to be discussing on prostate. Before we go into prostate cancer, we are going to define cancer. Cancer can be defined as a disease caused by an uncontrolled division of abnormal cells in part of the body. Uncontrolled division of abnormal cells in part of the body. Now let's define prostate cancer. Prostate cancer occurs in the prostate. The prostate is a small walnut-shaped gland which is in charge of supplying seminal fluid to the male organ, which helps to nourish and transport the sperm. The prostate is a small walnut-shaped gland which helps to produce seminal fluid that helps to nourish and supply sperm in the male gender. So before we go into prostate cancer, we are going to be talking of benign prostate hyperplasia. It's a condition closely related to prostate cancer. Most people mistake benign prostate hyperplasia as cancer. If you do not manage this benign prostate hyperplasia well, it can develop or go into prostate cancer. Although it shows no symptoms of advanced disease, so you might not know that you have benign prostate hyperplasia only if you are the type that go for medical checkup. So after seeing your health worker and you are being told you have benign prostate hyperplasia, please make sure you start treatment immediately so that it doesn't advance into prostate cancer. Because if neglected, it can advance into prostate cancer. Benign prostate hyperplasia will be discussed extensively in our next video or previous videos. So just stay tuned so that you'll be enlightened more about it. So let's go back into prostate cancer. It's the most common malignancy beyond the age of 65 in the male gender. So in most cases, when health workers when they get cases of symptoms that looks like prostate cancer within the age of let's say 50 below, they mostly or usually would not look for prostate cancer in the person. They will first check if the person have benign prostate hyperplasia first. After running the check and the checkup, and they realize it doesn't have benign prostate hyperplasia, that's when they might not look for prostate cancer. So prostate cancer usually occur from 65. Okay, let's limit it from 50 and above. Initially it's from 65, but we have seen some rare cases where the age of 50 and above are beginning to have prostate cancer. Usually underrated, especially in Africa. The record, if you have been diagnosed of benign prostate hyperplasia or you have been diagnosed of prostate cancer, that's not the end of the world. Please see your health worker and of course your counselor. Depressed, you don't suffer from anxiety, please see your counselor. That's not the end of the world. There's treatment. Cancer is usually underrated, but once prostate cancer spreads around the brain, the lungs and the liver, it becomes life-threatening to that person's health. So it is advised that once you notice you have prostate cancer, instead of you to allow it spread around your lungs, your liver or your brain, please seek medical help with immediate effect. So we are going to be talking of some risk factors. So those risk factors can be divided into two sections. We have non-modifiable risk factor and modifiable risk factor. So non-modifiable risk factors are those factors you have no control over. It just happens as you age, or it just happens as life revolves. But modifiable risk factors are those factors that your lifestyle determine if you're going to have prostate cancer, or your previous lifestyle that you lived led to the prostate cancer. So number one of non-modifiable risk factor is age. We all age every day. No one has control over his or her aging. So once you attain the age of 50 and above, you are at risk as a male of having prostate cancer. But it's so unfortunate that prostate cancer is not only limited to male now because of the rate of transgender. So some people that have done transgender have now been diagnosed of prostate cancer, especially those that were male before and eventually turned themselves into females. Number 2 of the risk factor of non-modifiable risk factor is genetic predisposition and family history. Although this is quite different from that of breast cancer, because there are some genes that are called genetic mutilation. That genetic mutilation it happens in a case where probably any of your sibling or your mom or your auntie or grandma has been diagnosed of breast cancer, ovarian cancer, cervical cancer. You are at risk of having prostate cancer due to genetic mutilation because of your family history. So once anybody in your family, if it's your male, has been diagnosed of prostate cancer, you are at risk. If any of your female siblings or your mom or grandmom or auntie has been diagnosed of breast cancer, ovarian cancer, cervical cancer, because of genetic mutilation, you are at risk of having it. That's why it is known to be non-modifiable risk factor. You have no control over it. Number 3 of non-modifiable risk factor is race. It is said that prostate cancer is common among the black, but less common among the Asians. But it's less common among the Europeans. So the European at lesser risk of having prostate cancer. But it's common among the black, a bit common among the Asians, but less common among the Europeans. So we are going to be talking, so we are done with non-modifiable risk factor. So we are going to be talking of the modifiable risk factor. That's factors that you as an individual can prevent so that you don't have prostate cancer. But some people hear of the factors and still play deaf ears to it. Number 1 of modifiable risk factor is obesity, or you can say high dietary fats. High dietary fat, forgive my pronunciation. That's if you take fatty food, oily food, and if you know you are obese, don't say you are somebody's peg. Please work on yourself. You are at risk at having prostate cancer. Then it is advised that you should abstain from red meat. Red meat are those animals that has 4 legs. Some people are going to come after me because some people don't know the classification of red meat. Red meat are those animals that has 4 legs. You see cow, you see goat, you see sheep, you see horse, donkey, etc. They are under red meat. White meat are birds like chicken, turkey, parrots, and so on. Those are white meat. Those are the meats that are encouraged that we should eat. So if you know you are obese, please try to work based on your nutritious dietaries that have been given to you by your health workers. And please always see your counselor so that you don't make rash decisions out of anxiety. Number 2 of modifiable risk factors. Those are factors that you can prevent, but you choose not to prevent it. Is smoking of cigarettes. These days I heard that men don't only smoke cigarettes, they go as far as smoking all sorts of things, all manner of things like gutter, sock away. If you know you are smoking now and you're a young man and you believe it's not going to affect your lungs, your liver, it might affect you at a later age in future. Probably when you are at the age of 60, 65 and above, you might end up with prostate cancer. Please abstain from smoking. It's advised that you abstain. Abstinence is the best. So we are going to go to number 3 of modifiable risk factors, sexually transmitted diseases. So if you keep having unprotected sex and you keep having series of sexually transmitted diseases, especially the untreated ones, you don't treat them, you just have them and you feel it will go later. At the end of the day, you are at risk of having prostate cancer. So it is advised that once you notice you have infection, you should please treat yourself. But abstinence is the best to prevent later case of prostate cancer. So if you cannot abstain, please make use of protection. The last but not the least, meanwhile, all these I am mentioning are the most common. There are several others. I'm just bringing the most common ones to you. So the last but not the least is permanent family planning. That's vasectomy. So if a man does permanent family planning, which helps in supplying nutrients to the sperm, if he does permanent family planning, he is at risk of having prostate cancer at the later future. I know some women will come for me, but stay tuned. In my next video, I'm going to talk extensively about it, and of course I'm going to bring the clinical features of prostate cancer to you. So don't forget to subscribe to my channel so that and turn on the notification bell so that when I bring the latest update concerning this permanent family planning and the clinical features, you will be there to be more enlightened. Don't wait till your life is at risk before you start running health scatter to check on yourself. And please always see your medical practitioners and your counselor. The essence of seeing your counselor is so that you don't take rash decisions, and at the end of the day you end up with anxiety, depression, and sometimes suicide or death. Please, counseling section is available at Royal Care Counseling Outreach. It mustn't have to do with your health. We are available for personal social problem, we are available for educational problem, vocational problem, and behavior modification. We are available. Personal social problems falls under marital, relationship, and your personal and social problems. So don't forget, we are Royal Care Counseling Outreach. Bye bye.